Hi, my name is Kathleen and I wrote this book, Loving Choices, Peaceful Passing, Why My Family Chose Hospice. And today I want to talk about hospice care and palliative care. And I'm going to start with hospice care. When my dad was diagnosed with non-Hodgkin's lymphoma, he was given 4 weeks to live without treatment. After the 3rd week of radiation, he was taken from the oncology clinic to the hospital via ambulance because he was too weak to take the treatment. When the doctor got to the hospital, he said Dad would need a stomach tube to continue the radiation. At that point, we rejected that idea and enrolled Dad in the Medicare hospice program, and we took him home. The Medicare hospice program is comprehensive and covered Dad's durable medical equipment, including the hospital bed and the wheelchair, everything he needed to be cared for at home. It paid for all the medications and the hospice nurse and other hospice personnel like the hospice chaplain. My sister and I took care of our father at home. He was very comfortable. The hospice nurse helped us every step of the way, and he passed away peacefully in his sleep 29 days later. Palliative care is different from hospice care in 2 ways. First, palliative care takes place even when a person is getting active treatment, such as radiation, chemotherapy, dialysis, or surgery. And people can receive palliative care even if they do not have a diagnosis of a terminal illness and a life expectancy of 6 months or less to live. Examples of a serious illness are lung and heart disease, cancer, liver disease, ALS, and HIV/AIDS. Palliative care provides pain management and also help with other distressing symptoms like fatigue, depression, constipation, nausea, and trouble sleeping. The palliative care team assists the current doctors with their plan of care, and they provide an extra level of care. Palliative care helps with filling out insurance forms and also helps with filling out the advance directive so that the patient knows that the doctor and the family is clear on what kind of care he or she would like. It also provides spiritual care if desired. Palliative care can take place in the home or in a community clinic, a cancer care center, or a skilled nursing facility. Palliative care is not a comprehensive benefit like hospice care, but the doctors and nurses who care for patients under palliative care are reimbursed by insurance. Some insurance does pay for social workers, but the palliative care personnel can help patients find out what else is covered under insurance for palliative care. So the big difference between the two is that fatal diagnosis and life expectancy of 6 months or less to live. That is the hospice benefit. Palliative care, that is not required. But the goal of both types of care is to keep the patient comfortable and support the family throughout the illness. If you'd like to know more about the Medicare hospice benefit, go on medicare.gov and put hospice in the search box. Again, the book is Loving Choices, Peaceful Passing, Why My Family Chose Hospice. You can buy it anywhere books are sold online. And if you live in the Los Angeles metropolitan area, you can buy it at Rowan's Bookstore in Pasadena. I hope you'll pick up a copy and give it a read.